Hello, this is a case study presentation by the team at Imicor Monitoring. Imicor delivers the only miniaturized TEE probe used for transesophageal monitoring in critically ill patients. The miniaturized probe enables direct visualization of cardiac size and function, information that is crucial in the assessment of critically ill patients and in fluid resuscitation. The Imicor Clarity probe is a single-use disposable probe that can be left indwelling for up to 72 hours. This type of episodic monitoring is the cornerstone for volume assessment in hypovolemic patients. This case is from Foothills Medical Center in Alberta, Canada. The patient is hypotensive and just been admitted into the ICU following a cocaine overdose. Background: a 32-year-old male patient is admitted to a combined med-surg ICU following a crack cocaine overdose complicated by acute renal failure and presumed sepsis. The patient was supported with mechanical ventilation and dialysis. 2 liters of intravenous fluid were administered and Levophed was initiated to support the patient's systemic blood pressure. The patient was persistently hypotensive with a BP of 79/56 despite increasing doses of Levophed. The method: attending ICU physician ordered a bedside TEE using the Clarity probe. The patient was significantly hypotensive and the procedure was performed without sedation. Results: the miniaturized TEE probe was placed without difficulty and a transgastric short-axis view of the left ventricle was rapidly obtained. Qualitative and quantitative assessment of left ventricular size and function indicated that the patient was hypovolemic. Additionally, the interventricular septum was observed to be hypokinetic. Given the young age, lack of cardiac history, and known recent cocaine usage, the wall motion abnormality was presumed to represent previously unrecognized ischemia. More aggressive volume resuscitation with intravenous fluids was instituted and the Levophed was titrated. Intravenous nitroglycerin was initiated to support vital organ perfusion. The Clarity probe was left indwelling overnight. Using TEE monitoring as a guide to fluid administration, Levophed was subsequently discontinued completely. Upon re-examination on rounds the next morning, the patient's blood pressure normalized 145/70. Intravascular volume status was normalized, and the left and right ventricular pumping function had improved. Conclusion: hemodynamic instability is a common complication in ICU patients with multi-system organ dysfunction. Intensivists need to rapidly correct underlying fluid imbalance and/or cardiac dysfunction. Rapid and accurate assessment and monitoring of the etiology of hemodynamic deterioration is often inadequate utilizing conventional monitoring methods. The Clarity probe is a unique and effective tool for assessing and monitoring hemodynamically unstable patients over a prolonged period of time in the intensive care environment. Thank you for your interest in Imicor Monitoring.